And there's a lot of, I'd say, technology and thought that has been put here in the development of these tags in order to enable them to get to that type of battery life.
Great, great. How are we doing, Dr. Val?
So we have a question about whether or not these devices can sense acceleration for people who might fall out of bed or be trying to fall out of bed or that sort of thing.
Okay, sure. So that is actually a very good question because even though people like to talk about the real-time location, we actually call it visibility. And visibility is really more than location. It's about location, condition, and status. And what we've done on these tags, we've added sensors in the past 2 years. We've actually added sensors. So each tag has a motion sensor. So I can sense if a person is not in motion for 10 or 20 minutes. We're also adding now exactly that fall detection accelerometer that enables you to detect the G level and all that. And that's something that's going to be coming up this year. But I'd say the hottest applications that are being used with sensors are actually temperature monitoring and humidity monitoring. So we have a temperature sensor on these tags. And now, again, guess what? You have the network. You don't really need another network in order to transmit the temperature readings. And it's quite interesting when you get into it. And of course, there's hundreds of refrigerators and freezers in a hospital, whether it's pharmacy refrigerators, lab refrigerators, nursing, food services, storing bone, tissue, breast milk, and many other sensitive items. And today, it's also quite amazing. All this in the majority of the hospitals is done manually, anywhere between twice to 4 times a day on hundreds of refrigerators. They check the refrigerator. They open the refrigerator, check the gauge, write it down, and they have to do it, and the Joint Commission actually audits it. So apart from being a patient safety issue, because you want to be able to have those sensitive items in safe temperature ranges, it's also a regulatory issue. And what we're doing, you basically place these tags, you literally place them in the refrigerator, they have the sensor on them, and now every 5 minutes or 10 minutes, they transmit the temperature reading of that refrigerator or freezer. So you're able to actually log that automatically, but also detect when it's going above range or below range and send an alert. And once you get an alert, you can actually now log in a corrective action. So all this process now, all this unnecessary manual monitoring is actually now being automated with our system. And back to your question, as time goes by, we're adding more and more sensors and getting more demand and more requests. And that's one of the things that we're now evaluating and doing some research on.
Are there any other variables that you're interested in measuring in the future? Things that maybe are just 5 years out or something like that could have implications?
Yeah. Some of the things that we're looking at are, for example, differential pressure for infection control between rooms. Others would be CO2 levels. We've gotten requests even for flood sensing. So to sense whether there's a certain level of water or flood, and again, send that alert over the wireless network when it's getting to certain levels. We've even gotten requests on oxygen cylinders. Again, that process is done manually today. To know whether the oxygen cylinder is at a level where it needs to be refilled, whether it's done by an external company or internally, again, that thing is done manually today, and being able to monitor that. So I think in terms of the types of sensors or the type of monitors that we'll be adding, the sky's the limit. Yeah.
Great. So I guess just kind of wrapping up, maybe just kind of share with our audience there, maybe if there was anything that I asked you, as far as your product, what else can you say about it?
So again, I think there's several things about this product. First of all, it's a complete solution. So apart from these tags that you tag on the assets, or whether it's patients or staff members, we also have the application that supports it. And the application enables end users to find in a very simple manner where assets are and plot out reports and get all the data they need on their assets. And it also enables, as we discussed in the beginning, the integration to the system, to the hospital systems and the relevant hospital systems. We're deployed today in hundreds of hospitals, and we have a broad set of applications, whether it's asset management, which is geared towards materials management, nursing, transport guys, distribution services, sterilization processing departments, managing the assets, managing the inventory levels, managing the par levels automatically in each unit. Equipment maintenance geared towards biomedical engineering. Preventive maintenance, for example, again, another issue item that's audited by the Joint Commission. Being able to do preventive maintenance on time. How many hospitals get to 100% preventive maintenance on time? Not many. If they get to 95%, they're happy. But what about all the labor that has to be invested in order to get to that rate, and searching for those assets 2 months ahead of time because you know you won't be able to find them? Or when you have a recall and you have 200 infusion pumps that you must recall and you don't want them to be connected to patients because there's a safety issue. At the click of a button, you know where all those 200 pumps are and you recall them. We talked about condition monitoring, but also, again, patient flow and patient safety. Whether it's a patient elopement application, a wandering trauma patient leaving the ward or leaving the building, a staff member in duress when he's dealing with at-risk patients or with patients in mental wards can just click on the button, and not only do you get a distress call, but you actually know where the staff member is, even if he's out of bed and he's not next to a wired nurse call system. And patient flow, whether it's the OR, ER, or any high acuity department, just have very tight management of the flow of patients and staff.
Great. And I'll leave you with the hardest question. Where can we find you on the show floor, and where can people find you on the internet?
Yeah, we are at booth 8055, and people can find us at www.aeroscout, AeroScout.com.
Great. Well, thank you so much for being with us.
Okay, thank you.
All right. So it's Mike Savella from HIMSS2010 from Better Health, getbetterhealth.com, and stay tuned for more of our coverage. We'll be right back.